we provide preventive and primary health care to underserved communities. People who are insured, people who are uninsured, underinsured. Anybody who walks through our doors can get health care, and we offer everything on a sliding scale based on your ability to pay. And we try to give everybody who walks through our doors that feeling of warmth and compassion.
In my view, one of the biggest problems we face here in Houston is the sheer number of people who do not have health insurance coverage. Without health insurance coverage, it's very difficult to access health care on an affordable basis.
Legacy comes in, and for people that otherwise would go into emergency rooms can come to Legacy and help relieve the stress on the ERs for their truly critical needs that they serve, and Legacy can help take care of those that can visit one of its several sites.
Children, pediatrics, wellness, mental health. I mean, it is just a, covers all services.
An entire family can come here and be treated for a variety of services for their overall health.
One of the things I do really like about Legacy is that we are able to treat everybody that walks in the door compassionately, with dignity, and as a whole. And we're not seeing just one symptom. We're actually assessing for everything and able to become their medical home.
I think that Legacy is a place where patients can come and get excellent health care in a setting where they're going to feel respected and cared for. We have nutrition, we have dentistry, we have vision, we have care for the parents. We're able to take that family as a whole and try to ensure that every member of that family is a healthy person, and that makes them more productive, that makes them, reach their maximum potential.
I think one of the things I'm most proud of that we've done lately is started a new program, which is a mobile dental clinic. The van itself is so cool. It's got a little waiting area, 2 full dental chairs. We've got x-ray in it, so we're going to actually bring dental care into the community rather than asking the community to come to us. We have not been known in the state of Texas for taking care of people who have mental illness. And it's very difficult for people to even get care because there's so little of it available. So we're thrilled that we're able to have behavioral health. It's been amazing to watch the difference in the families when they've been struggling with a young child who may be autistic but wasn't diagnosed.
Because of the communication that we have between pediatrics or case management, we can take care of their needs pretty much immediately, and we have a better idea of the patient as a whole to really cohesively identify what their needs are and help them with their needs.
Before Legacy, Nicholas was struggling in school. I was getting phone calls that he wasn't behaving. I didn't know what to expect on a daily basis. Mornings, I didn't know if he was gonna wake up happy or upset, and it was very difficult for me.
If I'd identify within the course of the interview that the mom is depressed, I love that I'm able to have somebody see the mom to help the patient as a whole.
Sometimes we do feel hopeless, and they provide the support that we are lacking.
They're able to come to one place where the pediatrician, the therapist, the speech therapist, everybody understands autism. It's much easier for the families to come and get all the treatment they need within one location.
Well, Nicholas is a different little boy now, and there's things that he's done in therapy that I was unaware that he was capable of doing. I get phone calls, not calling me to say, he's not doing well or anything, but to say that he's doing very well.
Our pediatricians are some of the most dedicated people that I know. They make every effort to make sure that those kiddos get all their immunizations, get in for all their checkups, and leave with everything that they need to stay healthy or to get over the illness that they have.
Curtis is my foster child. I'd had him for about a month when he had the first ear infection, and he had several more after that. When Curtis was first brought to us, he couldn't speak at all. He moaned and he grumbled, and he just made sounds, but he didn't have any words. Dr. Rodriguez told me the sounds that he's hearing are muffled because there's so much fluid in his ears. She just explained the entire process. It was the first time I had anyone explain to me what an ear infection was, and it was like she cared what happened to him.
And with that, we kind of took an interest in his whole family's case. She then started bringing her other children to see us as well. And we've managed to get Curtis to stabilize so that he's no longer, not enjoying life by being sick all the time. He's a happy, healthy toddler.
His speech has improved tremendously. He's speaking in complete sentences. It has really been beneficial to his health, to his hearing, and he is ready for school, and he's gonna do superbly. I think this has really helped him.
Back in the 80s, it was pure crisis. If you got an HIV diagnosis, it was a death sentence. And all of our services at that point were palliative care.
So that all changed in 1996. HIV and AIDS is no longer a death sentence, and people are able to have normal lifespans, and people are now able to live regular lives if they come to their appointments and take their medications regularly.
Once I came to Legacy and got back on my medications roughly 10 years ago, everything went very, very smoothly for many years. 3 years ago, I noticed a slight headache, and long story short, it turned out to be viral meningitis.
I remember one Christmas when I thought, we were really going to lose him. He was in a coma, and they were having a very hard time pulling him out of it.
It's a scary, scary thing to deal with and to go through. And for me, it was truly essential to have the care and the trust in the people providing me that care for me to be able to want to get through it, to want to go through the treatment.
Gradually after that, he started losing his sight, and it was a devastating blow for him. We all had to band together to try to pull him together and show him that there were things that we could do to try to help him, and there were services that we could get for him, to make life easier for him, and that he would be able to go on.
So it's been a tough couple of years, and these guys have been here for me the entire time. And with them having so many different services under the one umbrella, I guess, to be able to do it all in one-stop shopping, so to speak, it takes away so much of the stress. And knowing that these people all network between each other within the same organization, whoever thought this place up had a great idea. It's just incredible.
They have real results that you can measure, and you can see how many people they touch on a daily basis, a weekly basis, and how many families that walk away healthier because of coming through Legacy. And you can actually tie to reduced visits later on because these families are now leading healthier lives.
Legacy tries to go into the communities that have the need, and it doesn't just say, no, you have to come to us. So I was delighted to see how the number of different clinics that Legacy has, and it's growing, and that's what excites me even more.
Quality healthcare should be a right for all of the individuals in the community.
It's important to us to do what we can to make sure that people have the ability to access affordable health care. That makes all of us stronger.
Our mission is really to build healthy communities. And people ask me all the time, well, when will your job be done? My job will be done when there's a Legacy in every neighborhood that needs us.